example of what's the importance of early screening. Now, this is a patient of mine. She is Madam. She is 62 years old. She came with what we call a positive blood in stool test. She had no symptoms otherwise, and they did a scope for her, and I did a scope for her, and I noticed a tumor in the sigmoid colon. The CT scan shows a very small tumor with no spread, and eventually she could undergo a keyhole surgery. So this is the location of a tumor. This is the sigmoid colon over here on the left side of our tummy. This is her tumor over here, which is fairly small. Her CT scan over here, where I'm circling where the tumor is. And if you remember this image, then you will see how the difference it is between this patient and the next patient. The next patient was a 68-year-old taxi driver. He's an old patient of mine. He had symptoms of diarrhea for 1 year. He refused to see a doctor. His wife told him to see a doctor. He refused to. Eventually, he only came to hospital because he was so breathless. He came in with a red cell count of 4. And for us sitting here, for the man, your red cell count should be 13 and higher. So actually, he was less than half of his usual levels. I did a scope for him. He's got a very large tumor. The CT scan also confirms that the tumor is extremely large. But because it's so large, he had to undergo an open surgery instead of a keyhole surgery. And I think the only lucky thing for this gentleman is that the CT scan at that point in time shows that there was no tumor spread. So this is what we see. This is where his tumor is on the right side of the colon. And this is the tumor, as you can see, certainly much larger than the previous patients. And again, if you remember the scan I showed you previously, where I'm circling now is the entire tumor, and that's a very large tumor. So I think these two patients illustrate exactly what I've been preaching all along over the years, that if you can, go for colonoscopy screening. A colonoscopy is the best option if you can afford it. It allows you to screen and scan, and if you do find a tumor eventually, and it turns out to be, at that point in time, we have no symptoms, then at the very least, you have a smaller tumor, you're less likely to need chemo, you can go for keyhole surgery. If you, like this gentleman here, you find a large tumor, it's advanced tumor, then you have to go for open surgery, and then you have to go for chemotherapy. And I think that's essentially the importance of so-called colonoscopy screening.
Terima kasih telah menyaksikan video ini, dan jangan lewatkan video menarik lainnya dari channel Tkon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tkon TV.